What are crisis teams? Crisis teams can give you urgent help and support if you are having a mental health crisis in the community. This could be in your home. Crisis teams can also support you after you have been in hospital. What is a crisis? Having a mental health crisis can mean different things. Thinking about suicide or acting on suicidal thoughts. Going through psychosis where you're out of touch with your normal reality. Doing something that could put you or other people at risk.
A person has come to a point in their life where things have become too stressful. They're unable to cope with things that are happening in their life. That could be social circumstances, family circumstances, or a person can have a diagnosed mental illness or an undiagnosed mental illness, and the symptoms of that illness are unmanageable and they need help from a crisis team to have treatment and support for those symptoms.
Crisis teams are available 7 days a week, 24 hours a day. What support and help can a crisis team offer? The crisis support team will assess your needs, manage the risks of you being at home, assist with self-help strategies, visit you frequently, offer psychological and practical help, administer medication, help you learn from your experience so you can consider how to prevent or manage a crisis in the future. You might find that crisis team support can help you manage a crisis at home with friends and family. This may be a preferable option, as research has shown much higher satisfaction rates for CRHT treatment than for hospital inpatient wards.
Basically, they offered me the team members to come out, see me on a daily basis, monitor any medication that they gave them to me, and basically just make sure how I was improving, or if I wasn't improving, ensuring that my moods, they were checking on my moods, on my well-being, my family, pretty much everything. It was quite nice to have a few days off where somebody else was caring. It was just unusual. It was something you don't realise is there, and it's really nice to know that it is. And it's, how can I put it? It's only been sort of 3 months, a month for me since this started, and my mood and my change in my whole outlook on life is completely different, because I'm realising now that I wasn't on my own. There is somebody there to talk to. Yeah, I can't pick them up enough. I really can't. You know, it turned me around. It really did.
They were helpful in the sense that they used to come home instead of me going to the hospital or going to their center for them to see me. And that was quite beneficial for me, because I didn't think of going to the psychiatric unit to be seen. I may feel low if I did that at that time, because I'm a staff nurse and I know how it is when people are treated in the psychiatric unit, how others feel about them. But that time I didn't feel like that, because they came home to see me.
How did the crisis team support you?
My crisis was about anxiety and lethargy and depression, and that is how they looked after me. They gave me support. They reassured me. They gave me medications. They used to come and check on me to see how I'm doing, and if there is any thing they have to do, they do it just to get me well.
Did you feel confident that you could contact the crisis team outside of the times they had arranged for you?
They have a number that you can call out of hours, and they have their working hours phone number as well, so you can contact them at any time.
When will the crisis teams visit?
No, they ask me when will be convenient for me, and I tell them, or they give me options and I choose from the options.
That also varies. It can be once a day, can be 2 or 3 times a week. Sometimes it can be 3 or 4 times a day. It depends on whether we are monitoring medication and what the need is, really.
What are the benefits of being helped and supported by the crisis teams?
They can have regular support from their carers within the home, which is so important when you're not well. You know, being around your family, getting on with normal day activities, having your children around you, and just being able to lead as normal life as possible in very difficult circumstances.
So it'd be keeping them at home so that they're in a familiar environment. It's the least restrictive place for them, and to keep them at home with their families.
Hello. All right.
Yes, thank you. Come in.
All right, come in. Thank you. Hello.
Who works in the crisis teams?
So we're an alternative to hospital. We're a team of doctors, nurses and social workers. We support people at home by visiting them daily, getting them reviewed by our doctors and starting any treatment at home that they may need.
What does a support worker do in the crisis team?
I see my role as really varied. Some days I can be monitoring and observing people taking their medication. We can support them with help to access benefits if it's necessary. It's quite varied with shopping, all their daily requirements really, just to make sure we're up and dressed and get moving, anything that's necessary.
We will support, advise and guide you in planning your own care.
I also brought for you, Rachel, because last time I came we had a look at your care plan. So here's the finished copy
Oh, thank
for you to hold on to. If you want to have a look through that,
Yeah, thank you.
and just see if there's if I've captured everything that we talked about. When I come tomorrow, or if it's not me, one of my colleagues,
Yeah.
if there's anything you want to add or change on it, or if I've misinterpreted something when we've been talking,
Okay,
then
I'll
just
go
let them
through
know.
it. Yeah, thank you.
That's all right. And those are the other couple of leaflets that I said I would bring to you. Just a bit more information about the CATT team, because I think you wanted to share that
Yes.
with one of your family members or friends, didn't you?
Yeah, I did.
So that's information
you.
for clients and carers.
Thank you.
And that's just the other plan that we were talking about.
Oh, brilliant.
But we don't have to. I'll leave it with you and have
I
a
can
think.
just have a look through that,
Have a
can't
think
I,
through
and
it,
think about
yeah.
it. Yeah, thank you.
Okay.
How do you access the crisis team? Via your GP? Via the single point of access telephone number 0300 777 0707. Via your care coordinator? Via the ward staff if you have been in hospital? Via the rapid assessment interface and discharge team based at the accident and emergency department. What do you enjoy about working in a crisis team?
What do I enjoy about working in a crisis team? I enjoy the working with people from all different backgrounds, all different situations. Feeling quite privileged to intervene in circumstances where people need help. I enjoy meeting people and hearing their stories and being able to provide something to help them. I enjoy working with multidisciplinary team and hearing my colleagues' opinions about how things can be done and sharing knowledge for the benefit of the service users and their carers.
I enjoy I'm quite a caring person. I just love the element of caring for them and helping them get better, and it's really nice to see when there is a difference and help them to see if they have improved, because it's quite hard sometimes for a patient themselves to see the improvements they've made.
I enjoy helping people. Every day is different. Enjoy supporting people at home and trying to keep them out of hospital.